All right, welcome back to The Explainer. Today, we're diving into what is essentially the ultimate surgical playbook for mastering complex cleft palate repairs safely and effectively. We're unpacking a really fascinating, highly methodical approach drawn straight from a definitive research article on minimal blood loss palatoscopy. It's an approach that fundamentally shifts how surgeons navigate the tight, complicated tissues of the palate. So, to kick things off, we really have to ask the critical question defining today's exploration. When you're dealing with pediatric patients or even older individuals arriving late for care, how exactly do surgeons perform these complex palate repairs while keeping blood loss to an absolute minimum? It's a delicate, high-stakes environment, right? Well, the answer lies in a highly structured, almost architectural approach to human anatomy. This perfectly sets the stage. On one side, traditional surgery can honestly be a bit of a battlefield. We're talking significant blood loss, the terrifying prospect of postoperative hypoxemia, and severe tongue edema. But the minimalist alternative? It presents a brilliant shift in strategy. The goals here are a tension-free closure, dramatically shortened operating times, and, crucially, a much safer, highly structured learning curve for medical trainees. Here is our pre-op briefing for today. First, the cleft palate challenge. 2. Adrenaline saline hydro-dissection. 3. Zones of static resistance. 4. Tension-free surgical closure. And finally, outcomes and learning curves. Let's jump right in. Section 1. The cleft palate challenge. Navigating the risks. The main takeaway here is that prolonged operating times put immense physiological pressure on the patient. Tongue edema, for instance, is a well-known, really serious complication. It happens because of the prolonged pressure from the tongue blade used to secure the airway during surgery. Literally, as the clock ticks, the risks of airway obstruction and hypoxemia just skyrocket. So we desperately need a method that gets the surgeon in and out safely and efficiently. Moving on to Section 2. Adrenaline saline hydro-dissection, the secret weapon. Now, take a look at this massive ratio, 1 to 500,000. What does that mean? Well, by mixing just 1 single milligram of adrenaline into 500 milliliters of saline, surgeons create a highly effective, ultra-dilute tissue prep. This exact dilution is a total game changer. It completely avoids cardiac side effects like tachycardia or arrhythmias, which is absolutely crucial when you're working with pediatric populations, while still providing the vasoconstrictive benefits needed to minimize bleeding right from the very first incision. When put into practice, this hydro-dissection fluid basically acts like a wedge. It physically forces the tissues apart. It distends the layers, swelling them up kind of like a tiny water balloon. And this artificial distension separates those delicate tissue planes before a scalpel even makes a cut. That allows for incredibly easy flap approximation later on. It's just a beautifully simple, mechanical solution to a really complex anatomical problem. Okay, Section 3. Zones of static resistance, the battlefield map. You can think of static resistance kind of like tightly glued anatomical seams. They require careful chemical and physical unbinding to safely maneuver. Think about it. If you just try to pull these stubborn tissues together to close a cleft palate, the static resistance will fight back. The tissues might tear, or the stitches could eventually burst open under the strain. So the secret to a perfect, lasting surgery is releasing this tension entirely. What we have here is the definitive map of the surgical battlefield. It highlights the 4 stubborn bottlenecks, zones 1 through 4. These are the exact spots where tissue mobility is locked down tight. By mapping these out ahead of time, surgeons transform what could be a chaotic procedure into a highly predictable, step-by-step unbinding process. I absolutely love how this breaks down into a rule of 4. It gives surgeons a clear, rhythmic playbook to neutralize each zone. Let's walk through it. In Zone 1, at the posterior spine, you don't force it. You gently tease the muscle fibers away. For Zone 2, which is the high-stakes neurovascular bundle, incising the cone of periosteum releases the vessels safely. In Zone 3, the fragile hard palate nasal mucosa has to be released horizontally on the bone to avoid disastrous tearing. And finally, Zone 4, you incise the palatal aponeurosis parallel to the bone edge. All of this is elegantly aided by our saline's secret weapon. Which brings us to Section 4. Tension-free surgical closure, the winning maneuver. Following these precise steps ensures a tension-free closure. And by that, I mean zero physical tension on the patient's tissue, and honestly, zero mental tension for the young surgeon. First, we've released those Z1 to Z4 adhesions. Second, we address the levitator muscles. Because they're abnormally oriented in a sagittal direction, the surgeon uses fine, angled scissors to dissect and retroposition them horizontally. Finally, achieving a watertight closure with 4-0 Vicryl sutures becomes almost effortless. Because that static resistance is totally gone, the sutures simply rest the tissues neatly in place rather than fighting to hold them together. Breaking those static resistances allows for a flawlessly clean, perfectly aligned final repair. Following the careful dissection, the final closure is remarkably neat. There's no tearing, no aggressive pulling. It's literally the exact definition of a minimalist, tension-free closure. Just beautiful surgical execution. All right, final section, section 5, outcomes and learning curves, the post-game analysis. These concrete outcomes are incredible. They prove that identifying those zones of resistance directly eliminates the terrifying complications we discussed at the very beginning of this explainer. By utilizing hydro-dissection and respecting those 4 zones, the researchers reported no postoperative bleeding, no hypoxemia, and 0 airway obstructive problems. The tongue remained completely normal because the operating time was drastically reduced, which entirely eliminated that prolonged pressure from the surgical instruments. For sure, this is a massive victory for patient safety. Ultimately, this highly methodical approach acts as the perfect starting point, dramatically steepening the learning curve for medical trainees. Palatoplasty is heavily debated, you know? There are so many complex variations out there. But by giving younger cleft surgeons a clear, step-by-step playbook, use this specific adrenaline dilution, identify these 4 exact zones of resistance, release them this exact way, you remove the guesswork. You give them a safe, reproducible foundation to build upon before they tackle even more complex cases. As the researchers stated perfectly, identifying the zones of static resistance enabled us to perform better repairs. It's really not just about raw surgical skill. It's about having a superior surgical strategy. And I'll leave you with this final thought to ponder. If we can decode cleft palate surgeries this efficiently simply by mapping out and releasing these tight, stubborn tissue planes, what else can we demystify next? I mean, what other chaotic, high-stress surgeries are just waiting for someone to map their hidden zones of resistance? Thanks for joining me on this explainer, and as always, keep questioning the structure of everything around you.